memorize it. Memorize. I'm sure you want to see this question in full detail. Cold damage, 양민 channel pattern is one disease. With heat in three aspects. 양민 organ disease, 양민 organ pattern. See? Gastrointestinal heat body. Memorize. No question. Memorize. I'm sure you're going to see the questions in the book. Unbalanced motion, unbalanced right and left. But the Chinese people was considered, then Chinese doctors, how can we treat that kind of laterality issue? That is extraordinary. When I do my chongwai, is a 3-axis of the fertilized egg. This kind of lateral issue, AD extraordinary channel, is fairly effective to treat this lateral issue. 5 elements. Active time, most low energy time, and location. Everything about the 6 channel. The body exam. Open up the page 125. Primary channel, last point of stomach primary channel is the second toe. But there's another 2 branches. Another 1 branch goes to the spleen 1. Another branch goes to third toe. That means stomach channel has 1, 2, 3 toes. This is for the hunting. Successive hunt and eating and the digestion. Okay. Where is the spleen channel? Foot, medial side, foot. Stomach, foot, lateral, anterior. Morning channel is the meal channel, diet. Long G begins in your stomach. Little jaw of the stomach goes to the lung and moves up to the throat and then down and opens up the long one. Long one is not the first location of the long G. Middle jaw. You know how to make our ATP in our body. The glucose get into the cell and blah 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 digest and enzymatic catalysis and goes to pyruvate. And the pyruvate and this is nucleus. Pyruvate goes into the mitochondria. In the mitochondria, there is a TCA cycle. In the TCA cycle, we need a lot of enzyme and coenzymes, minerals, and vitamins. And we need the oxygen. Actually, 1 oxygen out of the 2. TCA cycle uses the pyruvate. Pyruvate is the end product of the glucose in the cycle. Pyruvate goes into the, only the pyruvate can get into the mitochondria. Mitochondria uses oxygen and they make ATP. 1 glucose made 46 or 48 ATP. Sugar in the fruit. So 2 glucose. 2 glucose is around 100 ATP. Lung. begins with your glucose. Meal. Lung goes to your lung, you get the oxygen, and make a Weiji, Zhongji. Glucose, oxygen, ATP. Where? What organ wants oxygen? Mitochondria. Mitochondria is in the cell. Every cell, except RBC. RBC just carries the oxygen. They don't use oxygen. They never use oxygen. Lung is like this. Lung channel begins in the middle jaw, originate in the middle jaw, and descend to the large intestine, and then goes up and bifurcate to the lung, and ascend to the throat. Throat is the lung channel area, not the lung organ. Lung channel goes to the throat. You have to understand the primary channel, superficial or internal channel, everything. You have to memorize everything about primary channel. This is your TCM anatomy if you want to use the channel theory. Okay, page 74. Lung cell is a luau. Luau point has its own channel. And divergent channel is to increase the internal in pathway, yang pathway, almost all large intestine points are used for treating the lung channel. Large intestine points are used for the dyspnea, cough, wheezing, sore throat. That's why the divergent channel works. Divergent channel is enhancing the connectivity between the in channel and yang channel, the pairs, in and yang pairs. Senior channel is orthopedic issues. Page 75. Who manages the diaphragm in TCM? Who manages the diaphragm? Lung channel. We are looking lung channel. In the 6 sentences, long senior channel spreads over the diaphragm and converts it into a region of a floating reef. What channel controls the diaphragm? What controls the floating reef? If I have a rib pain, if I have a zoster here, what channel is affected? What channel is good? Long one is here, around here. Long one is good for the muscular tendinous portion of the pectoralis minor. Have you heard about the thoracic outlet syndrome? Thoracic outlet syndrome has 3 points. They may be narrow, compressed. Scaling, anterior and medius. Scaling muscles, the neck. And the subclavian artery nerve vein comes through here. This is scaling muscle. It's over here. Subclavian space. And goes to the arm. Subpectoral space. There are 3 spaces that may be narrow. Thoracic outlet compressing the nerve and artery and vein to the arm. Pectoralis minor is here. And this guy is the thoracic outlet is compressed by the tense pectoralis minor. Acupuncture or acupressure and full massage and release of pectoralis minor. This open. Thoracic outlet. It's going to be wide. Just release the pectoralis minor. Okay. If you massage on your chest around here, locate your long one. Just above here, around here. It's a little bit tender. The pectoralis minor and major is released. You want to feel, you want to feel the chest is expanded. This is long one. Golgi tendon organ. Golgi tendon organ is a good point for releasing the whole muscle. Golgi tendon organ is located in the musculotendinous junction. Muscle tendon connects the muscle to the bone. Ligament connects bone to bone. This is a tendon. This is a muscle. Golgi tendon organ is here. Pectoralis minor, Golgi tendon organ is. This is insertion point. No, Golgi tendon organ. Motor unit is here. Motor unit. This is nerve, peripheral nerve. Motor unit is in the belly of the muscle. If you activate the motor unit, the muscle is going to contract. If we activate the Golgi tendon organ, the muscle release. His job, GTO, his job is protect the muscle. Motor unit, his job is contract the muscle. The opposite. Deltopectoral. Usually there are big vein in the deltopectoral angle. Please remember not to deep puncture. It's just a shallow puncture. And please remember the primary channel is in the dermis, not in the muscle. Long tooth is also in the deltopectoral triangle, just underneath the flat curve. Any questions? Long tooth is here. Just underneath, just one stone up the long tooth. Long tooth is not that much used. Long one is sometimes used. Why? Long one is the frontal point of the long. Frontal point of the long. Ritual below the axillary fold, lateral border of biceps brachii. What is the point in the middle of the biceps muscles? Pericardium channel. Here, medial border of the biceps brachii, heart channel. Lung, pericardium, heart. Large intestine, sanjiao, small intestine. The question is going to be like this. What is the channel in the middle of the yang side of your hand? What is the channel in the middle of the yang side of your hand? Sanjiao. Sanjiao. What is the channel most front, anterior of your inside of your foot, medial anterior of your leg? What is the channel? Technically, liver, below the knee. Above the knee is spleen. Liver and spleen is crossed. Where the liver and spleen channel cross? Ace. Long 5 is the most common in the location questions. You have to understand word by word in the location. Number 1, What is the category of the long 5? Category of the point. Hesse point. What is the function of the Hesse? 36. The function of the Hesse point is count flow G diarrhea. Count flow. G rebellion, calm down the G rebellion. There is major function of the Hesse point. What is the symptom? Lung G is rebellious. Coughing, wheezing. Let's look at the indication of the lung 5. The first indications, coughing, phlegm, asthma, wheezing, blah, 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 blah. Rebellious lung G down. Down bears the rebellious lung G is the main function of the lung 5, Hesse point of the lung channel. Okay. The location, again, medial side or lateral side of the tendon of biceps brachii. Lung, pericardium, heart. Lateral is lung 5. Medial of the tendon. PC3, pericardium channel. Okay. Red line, red mark. On the cubital crease of the depression of the radial side of the tendon of biceps brachii. Radial side, not blue one, red one. Red mark, you have to remember. Radial side or lateral side. This is radius, this is ulnar. Ulnar side means medial. Radial side means lateral. Radial side or lateral side of biceps, tendon of biceps brachii. The long 5. Medial side, ulnar side is a pericardium, PC3. Okay? Big star, you have to remember. You don't need to memorize the 2 tendons, but you have to memorize 1.5 June and the 4 categories. What is the function of the low point? Low connective point is treating disorder of the interiorly exteriorly related channels. If you activate lung 7, you can treat 2 channels, lung channel and large intestine channel. Lung 7 is the point, is the gate to get to the large intestine. Double treatment, 2 channel treatment. You can treat the 2 channel pattern. Command point, lung 7, command point. Command point means the point controls that area. Commander of that area. Lung 7 is the commander of face and neck, back of the neck. Large intestine 4. LI4 is the commander of the face and mouth. What does it mean? The confluential point of the landmine. Extraordinary channel, usually Ren and Du has their own points, right? Ren and Du has their own points, but the other 6 landmine, the other 6 extraordinary channel does not have their own channel, does not have their own points. Okay. Chongmai borrows the kidney channel, kidney points. How can I access the 8 extraordinary channel to treat the laterality? How can I signal to his body, okay, I don't use the kidney. Now I'm going to use your chongmai, not kidney. How can I sign to his body? Confluential. The 8 extraordinary channel has 4 pairs. Renmai, the opening point of the Renmai is long 7. The opening point of Inchiao is kidney 6. I need the first point. I need is opening point of Inchiao kidney 6. And the second point is paired opening point. Paired channel is Renmai. My second point is the opening point of the Renmai. If I need a kidney 6 and the long 7, kidney 6 first and the long 7, the opposite. These 2 points signals to his body, the practitioner is going to use the 8 extraordinary channel, not the primary channel. That is the confluential point of extraordinary channel. Long 7 is opening point of Renmai. Kidney 6 is the opening point of Inchiao. SI3 is opening point of Dumai, like this. Understand? The opening point of the Inchiao is the kidney 6. And the second point must be the opening point of the paired channel. Inchiao is paired Renmai. The wife of the Inchiao is a Renmai. The second point must be the opening point of the paired channel. The paired channel is a Renmai. That's why my second point is long 7. Long 7 is confluential point of the Renmai. And then the local point of Yangchao, blah, blah, blah. Okay? And the order to take out the needles is the opposite. The opening point of Inchiao, kidney 6, should be the last of needle. Take out the first point and the last point to remove. Understand? Category. Opening point of the Renmai is long 7. Command point, low point, command point, and Renmai opening point, and one more. You never find out in the dead man. Exit point. Long G exit from the long 7 and goes to the entry point of the large intestine. Where? No, LI4. LI4. Distal to the long 7 and the LI1 to 3 is a long G, large intestine G is all mixed. That's why the long 8, 9, 10, 11, long 1 to 3 has the very similar functions. What is the function of the Jing liver? Jing liver, celiac bone disease. Usually, the Jing liver point is around wrist or ankle. A joint tissue. What is the point? Lung, pericardium, heart. Pericardium Jing liver point is the best point for the carpal tunnel syndrome. Key meeting point. Key meeting point of the vessel. Influential point of the vessels. Long 9 influences the circulation of the vessel. Why? Radial artery. Pulse diagnosis. Long 9 is most commonly used the angina, circulation, cardiopulmonary, cardiovascular disease. Why? Long line representing the vascular condition. Why? You pulse. You diagnose the pulse at the long line. Right long line representing what? John Quantia, long line representing what? Right Chon representing what condition? Long means G, Zhongji. Zhongji comes from brain, glucose. Right kidney is a Mingman, fire. Heart, liver, blood. Left kidney, gene, essence. Long line. Okay? Long line controls every vessel. Meeting point of the vessel or influential point. Long line influences every vessel in your body. That means where meeting point of the vessel, long line. Jungian point is emergence point. See? There are a lot of sensory nerves in the terminal. Very painful. Revive the consciousness and acute fever. Jungian point is clear acute heat. So just several drops of bleeding out. Emergency. Acute fever. Subacute fever or sore throat. Things